Bismillahirrahmanirrahim. Today, my topic of presentation is Introduction to Maternal and Child Health and Maternal and Child Health Program. No one knows what is kept hidden for them as a reward for their good deed. Quran. Learning objectives, Introduction of Maternal and Child Health Program, aims of maternal and child health, definitions, objectives, sub-area of MCH program, activities of MCH program, need for MCH program, principles of MCH program, indicators, and recent trends in maternal and child health. By the end of this presentation, participants will be able to describe the introduction of maternal and child health, aims of maternal and child health, various areas, sub-areas of MCH, activities of MCH program, and some recent trends in MCH. Introduction. Mother and child are not only constitute a large group, but they are also vulnerable group or special group. In developing countries, they consist of 71.4% of population. Children are foremost priorities of community health programs. Their aim is to increase the nutrition level of mother and children to ensure the birth of healthy child. Mother and child should be considered one unit because during antenatal period, fetus obtain all building material and oxygen from the mother, and also the child health is closely related with mother health. If the mother is healthy, the baby is also healthy. Certain disease and condition, for example, syphilis, drug intake, and German measles of the mother during pregnancy also affect the fetus. After birth, child is also completely dependent on the mother, uh, mainly on the age 6 to 9 months for their feeding. Also, the mental and social development of child is dependent upon mother. Mother is also the first teacher of child. Therefore, mother and child is considered as one unit. Healthy moms, healthy babies. Maternity cycle. The stages of maternity cycle is consist of fertilization, then fertilization, antenatal or prenatal period, then intranatal period during delivery, postnatal period after the delivery, and interconceptual period. Maternal and child health definition. The maternal and child health is actually the promotive activities, health promotion activities, preventive strategies, curative and rehabilitative health care of pregnant women before, during, and after delivery, and of infants and preschool children from birth to 5 years. Sub-areas of maternal and child health. It includes maternal health, child health, family planning, school health, handicapped children, adolescent, and health aspect care of children in special settings, for example, daycare. MCH domain, women and maternal health, child health, adolescent health, psychosocial counseling or psychiatric counseling of children, and prenatal infant health. Objectives of maternal and child health is the reduction of maternal, perinatal, infant, and childhood morbidity and mortality. Promotion of reproductive health. The objective of MCH is to regulate the fertility so as to have wanted and healthy children with when desired. Provide all basic maternal and child health to all mother and children. Promote and protect health of mothers. Promote and protect physical growth and psychosocial development of children. And the ultimate objective of the MCH program is lifelong health. Components of maternal and child health. It includes antenatal care, which is care during the pregnancy period, intranatal care, care of mother during delivery, postnatal care after the childbirth. Infant, which include under 5 clinics, immunization, nutritional disorders, dealing with nutrition disorders in infant, various training programs, and health education. Infrastructure of maternal and child health. The MCH services are mainly rendered through the infrastructure of primary health care and sub-centers. The maternal and child health services are now provided as the integrated package of essential health care, according to WHO, is also known as primary health care. Primary health care, which includes the principle of equity, intersectoral coordination, and community participation. Equity is actually providing the delivery of services to most vulnerable group or the people who are most in need. Intersectoral coordination principle of primary healthcare is various multi-sectoral coordination and not only the development of health sector but also involvement of other sectors such as agriculture sector, food sector, educational sectors, and community participation, community involvement of community leaders, various speakers, and various in and ultimate of all these principle of primary healthcare is to lifelong health of the mother and child, which can achieve through primary healthcare. And now MCH are provided as integrated package of as a primary healthcare, which is based on the principle of community participation, intersectoral coordination, appropriate technology, support mechanism made available. MCH pyramid of health services. MCH include the direct healthcare services, which include, for example, direct which is provided in basic health units and health services for psychological. Enable services include the transportation services, outreach services, health education, family support programs, purchase of health insurance, case management, coordination, and education. Population-based services, which include newborn screening, lead screening, immunization, sudden infant death syndrome, counseling of mothers, oral health, injury prevention, nutrition, and outreach and public education. Infrastructure building services include need assessment, evaluation, planning, policy development, coordination, quality assurance, standards development, monitoring, training, applied research, and system of care and information system. Epidemiological aspect of maternal and child health. Epidemiological aspect of maternal and child is actually the distribution and determinants of health related status or events in mother and child and the application of this study to the control and prevention of health related to the mother and child. It actually follows the systematic assessment of health of the woman in reproductive age and in children in the community, which includes timely collection of data, analysis, interpretation, and dissemination and use of MCH-related data. If we talk about epidemiological triad in agent is child, host is mother, and environment. Agent, it includes child fetal life, nutrition, change in hormone level, growth and development of childhood, nutrition, physical care, growth and development, socialization, and care during illness. Host is actually the mother, which includes mother nutrition, physical health, genetic inheritance, and social status. Environment may be physical, biological, and psychosocial environment. Now, MCH problems, according to triad, the maternal and child health, there is a triad which is affecting the MCH is actually include the unregulated fertility, infection, various infection of mothers including syphilis, torch infection, German measles during pregnancy affect the growth of the child. Malnutrition also affect malnutrition of children develop various disease and leads to infection. It is actually vicious circle. Malnutrition leads to infection, cause lack of immunity, and infection further lead to malnutrition. And unregulated fertility, which results in increased unplanned pregnancies, lack of family planning services, and increased low birth weight babies, and increased maternal morbidity and mortality, and also infant and newborn neonatal mortalities and perinatal mortalities. Now, come MCH programs. The activities of main MCH program is the maternal and child health services are important part of primary health care. The traditional activity of these programs is complete health checkup and care of child and mother from conception to birth. And the activities of this program is to studying health problems of mother and children, providing health education to parents for taking care of children, training to professionals and assistant workers. Need for MCH program. There are four reasons why mother and children health must be given top priorities in any health programs. Because mother and child below the 15 years of age make up the majority of population in almost countries, especially in the developing countries. Mother and child consist of a special group or vulnerable group in the case of illness, death in terms of pregnancy, childbirth of mothers, and growth development in case of children. By improving the health of mother and children, we can improve the health of family and community. It ensures child survival, which is a future investment for the family and community. Indicators for maternal and child health. Following indicators can be evaluated on the basis of following indicators. Mother and child health program. It includes maternal mortality rate, infant mortality rate, death rate of 1 to 4 years old age group children, size of the family, perinatal mortality rate, and weight of minimum 90% of total population according to height or weight charts. Now, recent trends in MCH program with the passage of time, there is some recent trends have developed in MCH program. First of all, it is the integration of care. Earlier, the MCH program services are split and divided into antenatal, child, and family planning services. Now, it is useful. It become capacity building as well, and there is effectiveness of services and new concept which is given by WHO is risk approach, which is the new thought was born because of lack of resources and availability. And as per this approach, the risk group among mother and child is identified as special care and special given care is given to them according to equity. Manpower changes is also developed according to new concept. Maternal and child health services should be left to traditional health workers rather than specialists of field and child volunteers and workers of NGOs. Risk approach is actually the managerial tool for improved MCH care. Purpose is to provide better services for all, but special attention is to those who need for them. And it is maximum utilization of resources. High risk mothers are elderly primary, shorter primary gravida, male presentation, antepartum hemorrhage, threatened abortion, preeclampsia, eclampsia, anemia, twin pregnancies, hydramnios, previous stillbirth, IUD, intrauterine death history, manual removal of placenta, elderly grand multipara, previous prolonged pregnancy, history of previous C-section or instrumental delivery, and pregnancy associated with general disease. Recent trends in MCH program is also the primary healthcare involvement. It makes available information about the protection and resources for mother and child health. As per decision taken in World Women Conference in Beijing, maternal and child health services have included in reproductive and child health services. A guiding principle for MCH program. It includes consultation and participation by families, which is integral to the services. Services will be informed and seek to meet the young needs of young children and their families, assess and availability. All families with young children should be able to readily assess the information, services and resources that are appropriate. Early prevention. Prevention of harm is preferably to repairing it later. Early detection of risk factor capacity building, promotion of resilience and capacity building is preferable to allowing problems to undermine health or autonomy. Equity. All children should be able to grow up actively learning, healthy, sociable and safe irrespective of their family circumstances and background. Family-centered, the identification and management of child and family needs according to family-centered approach. Inclusive practices are essential for all children to get the best start irrespective of their family circumstances. Partnership. Quality services are achieved through integrated services delivery and partnership with other early childhood and specialist services. Quality. All families with young children must be confident for the quality of information services and resources provided. MCH service program standard. The MCH services provided universal access to services for children from birth to school age and their families. MCH services promote optimal health and development outcome for children from birth and mainly focus on children, mother and family. It will partnership with families, communities and collaborate and integrate with services and other organizations. The MCH services are delivered by a competent and professional workplace. The MCS services are supported by local government and governing authority and provides a responsive and accountable services. Services for children, mother and families through effective governance and management. And the MCS services deliver a quality and safe services. Organizational activities include complete health checkup and care of children and mother from conception to birth, studying the health problems of mother and child, providing health education to parent, training to professional and assistant. Responsibility of community health nurse with MCS services is providing depth care. They can also provide managerial function and educational health education functions to mother. Now, maternal and child health program in Pakistan. With the help of USAID, new maternal and child health program, which are consist of five major components, working with public-private partnership, including the mix of government of Pakistan, private sector, philanthropic sector, and non-government organization, local civil society, and community organization is started. These components include family planning, reproductive health services, maternal and newborn child health services, health communications, health commodities, supplies, and health system strengthening. It was actually launched in 2007 in Pakistan to accelerate progress towards Millennium Development Goal 4 and 5, which can achieve primarily through providing emergency obstetric and newborn care services and deployment of new care of community midwives and institutional strengthening, especially at the provincial district level. And the goal of four of MDGs as is to reduce the child mortality and five is improve maternal health. The MCH program goal is to reduce maternal and child death and illness by improving the health status of all, particularly of poor and marginalized population. And the outcome is to improve the accessibility of high quality and effectiveness MCH services for all, but particularly the poor and disadvantaged community through development and implementation of sustainable MCH program at all levels of healthcare delivery system. Components include integrated delivery of services at district level, training and deployment of community midwives, provision of comprehensive family planning services, strategic communication of M&CH care, strengthening program management. Now, comparison of if we compare the current status and MGT target for 2015, the infant mortality rate is 78 in 2015, and according to MPGs, it is should be 40. Maternal and mortality ratio is according to MPG's target, it is 140, but we are stand 276. Contraceptive prevalence rate is 30%, and according to MPG target should be 60%. Total fertility rate is 4%, but according to MPG target should be 2.1%. Population growth rate is 1.7%, and in MPG target it is 1.3%. The MCH and program started in 2007. After 3 years of implementation, evaluation of this program is conducted in September 2011 to 2012 across Pakistan, steered by Planning and Development Division. Considering implementation challenges and resource constraints, findings of this evaluation indicate that program focused on two major outputs: emergency obstetric services and community midwives, which have shown marked progress, institutional deliveries, and skilled birth attendants. However, in this program, after evaluation, management structure have not been strengthened as per the PC1, and the program is lagging behind in provision of comprehensive family planning services and communication intervention for improving M and CH care. And therefore, after evaluation, the key recommendation should be recommended that the integration of current M and CH program into provisional health sector strategies under the direction of Provisional Director General Health. Prioritize the funding and around a package of essential M&CH intervention with a strong focus on district level and below. The contractual contract of nationwide outsourced and vertically managed VHOs through the People Primary Healthcare Initiative needed to be revisited. Integration and linkages with Population Welfare Department to address challenging facing implementation of integrated maternal and child health program. Public and private partnerships for services and community mobilization should be strengthened, institutionalized to the role of community midwife workers into the first level of referral in the catchment area. A uniform community health workers retention policies need to be approved by the appropriate body followed by implementation. Now, some recent advances. In Pakistan, a situational planning of 12 countries, Pakistan has highest burden of neonatal mortality with neonatal mortality rate of 46 per 1,000 live births and estimated to 4,400,000 newborn deaths per every year. Considerable progress have been made in finalizing and posting provincial newborn plan. These plans began development at nationwide and provincial level. Each province identified the bottleneck and challenges in their maternal and newborn health. The Ministry of National Health Services Regulation and Coordination in Islamabad has finalized the maternal and child health strategic planning for 2016 and 20. The Punjab province, home of the national population of Pakistan, completed and posted a newborn action plan in 2015 and began implementation in 2016. Since Balochistan and KPK provinces drafted and posted newborn survival strategies. Punjab is leading by example. MCH problem in Pakistan. It is include also triad of malnutrition, infection, and uncontrolled reproduction, which affect the health of mother and child in Pakistan. For example, if we see nutritional indicators, 45% children is stunting, wasted, and obese is 2.8, and malnutrition is more prevalent. Mortality and risk indicator we show under 5 mortality rate is 81%, neonatal mortality is 46%, stillbirth is 33%, and low birth weight is 32%. And also under 5 mortality rate is increased and neonatal mortality as compared to neonatal mortality rate. The cause of the death under 5 children, 11.5% is pneumonia, birth asphyxia, sepsis, congenital anomalies, diarrhea, measles, injuries. Coverage of essential intervention across continuum of care, access to improving drinking water is 95%, coverage of IMNCI is 29%, oral rehydration treatment is given 72%, pneumonia seeking 64%, and early initiative breastfeeding is 18%. If we see under 5 mortality rate trends in Pakistan, although it may be high, but it can be disproportionately increasing and decreasing. But in 2019, according to UNICEF, it is decreased as comparison to previous years. But still, the under 5 mortality rate is high in Pakistan. 6.6 million deaths per year for children under age 5, most of them are preventable, but and 289,000 maternal deaths per year. And the reduction of maternal and under 5 mortalities among the most group of global health priorities and most promising group of preterm births, pneumonia, diarrhea, malaria, and other health challenges result in almost 6 million deaths per year for children under 5 years of age, but most of them are preventable. National Vision Action Plan is given 2016 to 2025 for coordinated priority action, which are addressed challenges of reproductive, maternal, newborn, child, adolescent health and nutrition. According to this, Pakistan is sixth most populous country. Is 64% of population Pakistan population lives in rural areas and 32% is adolescent between 10 to 24 years of age. Illiteracy, lack of understanding on sexual and reproductive health matter, and use of any contraception is 10% among married women, according to DHS survey, and 66.9% use of any modern method. And this shows that the underutilization of family planning services. According to National Vision Action Plan, every newborn impact framework is given and ending preventable deaths for women, stillbirth, newborn children, improving child development and human capital include for early women, reproductive health care, pregnancy care, early newborn care around birth, care of small or sick newborn, every child include postnatal care, child health care and development, and adolescent health care. And in the quality care with innovation, which include output health, workforce, commodities and technologies, health system, information system, community empowerment, health home behaviors. And inputs include contextual factors, leadership, governance, partnership, and financing, availability and data for action to achieve equity. And impact of this framework is to ending the preventable death for women, stillborn, and newborn children, and improving childhood development and human welfare. Government of Pakistan remains committed to support the efforts being undertaken to accelerate improvement in newborn child and maternal survival. Packages in continuum care focus on every newborn action plan. The action plan include the time around birth resulting in majority of maternal and newborn deaths and stillbirth as well as human capital loss. The packages have the highest impact, some of the lowest coverage of equitable and quality care across the continuum. Another program according to UNICEF will study reaching the every newborn national 2020 milestone. About every newborn action plan in 2014, a 67th World Health Assembly endorsed the every newborn action plan to end preventable deaths. The every human present evidence-based solution and set out clear path to 2020 with 8 specific milestones for what needs to be done differently to greatly reduced mortality rates and improved maternal newborn health by 2020. To complement the global strategy progress reporting, this report provides a detailed look at the country leadership and action towards every newborn national milestone by 2020. The goals of the Every Newborn Action Plan was developed in response to country demand and set out a clear roadmap for how to improve newborn health and preventable by 2030. It presents evidence-based solution to prevent deaths and improve health. The goal is one is ending preventable newborn deaths 12 or less per 1,000 live births by 2020 and ending preventable stillbirths which is 12 or less per 1,000 total births by 2030. Guiding principle includes country leadership, human rights, integration, equity, accountability, and innovation. National 2020 national milestone include national plans, which is review and sharpen national strategies, quality of care, adopt standard quality of care, investment in health workforce capacity building, community engagement and involvement, parent voices and champions, includes addressing the social norms, data, research and innovation, and analysis of impact of newborn survival policies in Pakistan using a triangle framework is presented, and the purpose of this is to identify gaps and contextual barriers. The result of this is to that there is the major problem and reduction of newborn mortality, endorsement of newborn survival goals and targets, lack of time-bound targets. Issues of maternal health in Pakistan trend towards Millennium Development Goal 5. There is decline in MMR for 90 maternal deaths in 90 to 60, from 1990 to 60 maternal deaths per 1,000 live births in 2010. Reduction in MMR by three quarters was not achieved by but decline and assess based on progress level assessment WHO guidelines assess of Pakistani women to universal reproduction health unit fall in moderate category in 2010 as compared to earlier low assess in 1990. Now, from the another program is what can Pakistan do best maternal and child health over the next decade. Progress in basic should be addressed. Pakistan should address poverty, undernutrition, safe water, sound sanitary conditions. And another program, Know, is also aims to project the improved maternal mortality, whose protocol has been published and is working on, which is actually to see effect and feasibility of district level scale up of maternal, newborn, and child health intervention in Pakistan. Conclusion: MCH are one unit and most vulnerable to the morbidity and mortality. MCH program emphasizes the analytical skill to address the healthcare of Pakistan. MCQs. Investing in health for women and children is a vital part of right of health, encompassing reproductive and maternal health. Which of the following health services comes under the domain of MCH? Nutritional intervention of women during pregnancy, tetanus toxoid application during pregnancy, treatment of hypertension during pregnancy, psychotherapy of women during postnatal period, and nutritional intervention, tetanus toxoid application, hypertension during
E,
pregnancy. Yes, E.
E,
Because it include all promotive, creative, and psychotherapy services which are provided under health services. MCH is defined as promotive, preventive, curative, and rehabilitative health care for mothers and children. The ultimate objective of MCH is to reduction of maternal and child health, promotion of reproductive health, promotion of physical and psychological development of child and adolescent, or promotion of lifelong health.
A,
A.
D.
Delta, all are although all are the objective of MCH, but the lifelong or ultimate objective is to promotion of lifelong health of mother and child. According to new strategy, the MCH services is provided as integrated package of essential health care. Which of the following are according to principle of PSC? Community center offering free low-cost checkup to everyone, providing better education, testing and treatment access to pregnant women in any community, promotion of health sector in any community, community mobilization.
C.
B is a correct
B.
answer. B, because it involves the community according to need. In alpha, it is actually just equality means everyone, and in promotion of health sector, it is not just the multi-sectoral coordination because if we should also give attention to food and agriculture department also. And community, it is actually the community participation. Although community mobilization is involved, but the principle is actually equity and answer is beta. A public health team visited MCH Center in XYZ community where they found higher birth rates of newborn, increased prevalence of low birth weight babies, and high maternal and perinatal mortality. Which sub area of MCH is not operating well in this MCH center? Maternal health, family planning, school health, handicapped children.
Handicapped children.
Beta is correct answer because family planning services come under because in this center there is low birth weight babies, high maternal mortality, perinatal mortality. It means there is family planning sub area is not working well in this center. In XY village of Punjab, the infant and mortality rate is very high. Local trained birth attendants and lady health workers provide outreach counseling services to mother with respect to prevention of diarrhea, breastfeeding services, and also provide counseling to go nearby center if diarrhea becomes severe. Which type of MCR services were taken into account by lady health visitor? Direct healthcare services, infrastructure enabling services, population-based services, or both?
A.
A.
Correct answer E, because they are providing outreach which are not come under depth services, population-based services, and enabling service. Both are provided by lady health visitor and traditional birth attendants. A public health team wanted to start a health program in XYZ community where they found that 75% population is almost mother and child health below 15 years of age. There is also higher birth rate of newborn, increased prevalence of low birth weight babies, and high maternal and perinatal mortality. Which health program must be given top priority in such health program development in this community? Community mental health, health
E.
insurance. E, because
E.
reproductive and child health, because in this community there is high maternal and morbidity mortality. XYZ community faces a lot of maternal and child health program, and only one program is running presently in this community. And management team found that it becomes unable to run the program because of resource constraint and funds. Which should be best strategy adopted in this scenario? Offering free low-cost checkup to everyone, store the health program, adopt risk group approach, adopt risk approach as well as build partnership with families, communities, and collaborators.
T.
Delta is correct answer because we should also adopt high risk strategy as well as to further replenish or continue the program. We should build partnership for funding for outsourcing of sources and collaboration. An initiative to develop MCH program in XYZ urban community are receive fund from local government, community leaders, and business owners. Key stakeholders are identified and contacted. The main outcome for this MCH program in evaluation metrics will be decreased maternal mortality and morbidity, training and development of community midwives, strengthening the program, or improving the accessibility of high quality and effective MCH services. Delta is correct answer because outcome is the improve of accessibility of high quality to effective MCS services. All other are the actually objectives of this program, and the main outcome always come in evaluation metrics. In XYZ community, a public health team found an increase in prevalence of under 5 mortality rate, neonatal deaths, low birth weight babies, pubertal sepsis, and high maternal mortality. Which MCH problem most responsible for this in this scenario? Malnutrition, infection, uncontrolled reproduction, delta, or both three?
D.
Delta.
Yes, it also includes malnutrition, infection, which is given, for example, pubertal sepsis and uncontrolled reproduction, because there is also increase in birth rate and deaths under 5 mortality rates. According to about every newborn action plan, preventable stillbirths and newborn deaths by 2023, 2025, 2028,
2025.
2030.
2030.
Every woman action plan is actually developed to preventable stillbirths and newborn by 2030. And these are key and references, and thank you.
Dr. Khansa again. Addressing the health and well-being of women and children is a major challenge in Pakistan. And as you have presented that we have many constraints of the budget and resources. So I am really very hopeful that whatever you have delivered in such a short period of time, it was very comprehensive account on reproductive, maternal and newborn and child health. And as you have said that maternal, newborn and child health should be taken as one unit. And another important part is about the nutrition of mother and children in Pakistan. So whatever we are considering in MCH, it is directly related with nutrition. So the compilation of this important recent advances, research, and how we are increasing awareness about the issues and plausible solutions, that is important. According to your presentation, it is again we have seen that it is a very big task or a gigantic undertaking that we need evidence about various areas of mother and child health and nutrition. And still, we are lacking in many important areas, as you have said, due to resource constraints and due to the difficulty in getting the advocacy for equity. And we still